Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rulo. Finally, someone willing and able to blow the top off hidden healthcare and hospital dangers. She's provocative, upbeat, balanced, fearless, fresh. Pat has over 20 years of experience as a professional public speaker and knows how to approach this important subject with enough humor and wit to keep you informed, entertained, and empowered. Each week you will say, "Oh," as Pat explores and exposes little-known hospital hazards, delves into the deep waters of dangerous healthcare practices, picks the brains of her good-looking and influential guests to help keep you and your family safe in today's fragmented healthcare system. The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rulo.
Well, today is another great day because you are here with us. You know, I take patient safety seriously, and I hope you do too. You certainly need to pay attention and be aware of the hazards out there before they encounter you or before you encounter them. And I know our guest today feels that way because, well, I won't spill the beans right now, but if you know of anyone who plays a brass or a wind instrument, grab them, call them. They must hear today's show. And I'm not just blowing hot air. But now it's time for the healthcare hazard of the week. So, doctor, I have what? Wait, can you repeat that? How is that spelled? Wait, I can't understand what you're saying. Well, don't get upset. I just don't know what those words mean. Can you slow down, please? I still don't understand. I have more questions, please. Can you stop typing into your computer and look at me? So what's the treatment? Did you say 3 times a day? Please hear me. I don't understand. Considered a medical error, a misdiagnosis can occur by diagnosing the patient with the wrong condition, failing to diagnose anything at all, or delaying diagnosis and allowing complications to develop. A diagnosis is an educated guess. Doctors derive this guess by reviewing the set of symptoms and any test results. Although test results are an important diagnostic tool, they are not without hazard. Not only can a test be performed incorrectly, but the results can be interpreted incorrectly too. Many times the test results are inconclusive, so now interpretation and supposition comes into play, and it all becomes more vague when drugs, procedures, and surgeries are thrown into the mix in an attempt to determine the problem. Each test, treatment, and intervention comes with its own potential for error. The more tests you have, the greater margin there is for a mistake. Meanwhile, you may not get the treatment for the condition you do have, or be subjected to risky treatments for problems that you do not have. It's a fact. Misdiagnosis rates in the intensive care unit have been studied, with rates ranging up to 40%. In fact, reports show that nearly 1 in 6 people have been misdiagnosed at some point in their medical history, and that is scary stuff. Another way to think about hospital misdiagnosis is to remember the law of the instrument. When you talk to a surgeon, the problem and solution will most likely involve a surgery. Say you talk to a holistic practitioner and he or she might point to therapies, herbs, and lifestyle changes. So it's very important to get several opinions from reputable sources before deciding upon a form of action that might only speak to the preference or the inclination of the person making that recommendation. So how does a misdiagnosis happen? Well, it can happen if a doctor fails to take your complaint seriously or fails to notice or understand the nature of your symptoms. It can happen if a doctor fails to refer you to a specialist for further testing or treatment, or by ordering the wrong test, misunderstanding the test results, or misreading lab reports. Poor x-rays and other imaging errors can also cause a misdiagnosis. How about the lack of focus, fatigue, a rushed and harried behavior on part of the doctor? That can certainly contribute to a wrong diagnosis. Or how about we, as the patient? We can be a problem when we don't share everything with our provider. We have to be accountable too, you know. The only way to get an accurate diagnosis is by sharing accurate information, even though it is sometimes embarrassing to discuss sensitive symptoms. Well, here's a few things to look for to avoid a misdiagnosis. Number 1, look for test results that don't match with the diagnosis. So if your test results have little to do with the diagnosis, then question the validity of the test and question the diagnosis. This could be a red flag that one of the two isn't right. Number 2, look for treatment that does not work as expected. It may not be working because it's not a match for the true diagnosis. Either the treatment is wrong, or perhaps the diagnosis is wrong. It's definitely a starting point. I remember my gut feeling of a misdiagnosis when my doctor prescribed an antibiotic for a throat symptom I was having, and despite taking the entire course, my symptoms didn't improve. Turns out I didn't have what he thought I had. Therefore, the drugs were useless and therefore dangerous to my health. Number 3, if the doctor is short with his or her time, or if he or she is vague, demand answers until you are satisfied, or change doctors. Number 4, always look for a second or third opinion if the first diagnosis or treatment option seems drastic. And number 5, to avoid a misdiagnosis, think about your gut feelings. You know when something's not right, and that's something worth remembering. I did this. I remember when my mom was in the hospital, about, I'd say 2 months into it, they diagnosed her as being depressed. Hello, been on life support for 8 weeks, kind of depressing. So they gave her high doses of antidepressants and anti-anxiety drugs until she began to see bugs on the wall and babies on the tray table. Well, my gut reaction was wrong diagnosis and medication side effects. So pay attention to your gut feeling. Well, here's some additional questions to ask your doctor about your diagnosis. First, ask, how sure are you of the diagnosis? Ask, what else could it be? Is there anyone else with whom we should consult? It's especially important to question all radiology reports. Here's a question to ask. Are the images and biopsies clear enough to be read and interpreted with accuracy? Did your doctor speak directly to the radiologist or technician who read and interpreted the report? Or is the doctor merely reading a copy of the report? Did the images rule out the problem? Or did the images simply fail to show the problem? So these are some things to look for, and be sure to keep track of all radiation exams. And here's a tip that frightens people. Be proactive when it comes to finding out your test results. Don't assume that no news is good news. You have every right to request and receive information about your test results. And then once you've received the verbal results, ask for a printed copy for your file. Remember, this is not being a pain in the butt or trying to push or hurry someone. This is you managing your health and your life. What else could be more important? Your doctor has not seen everything. Usually, doctors see about 300 different diagnoses throughout the course of their practice. This leaves a lot of room for error. So when your doctor announces your diagnosis, always ask, what else could it be? And to reduce the chance of receiving a misdiagnosis, bring someone, a trusted friend or a family member with you to the doctor's office to help you take notes. Your health is not the time to worry about hard feelings. Any worthwhile doctor should encourage you to understand your diagnosis. So what's the treatment? Did you say 3 times a day? Please hear me. I don't understand. Well, it's time to spend the next 2 minutes with my friend Hari Khalsa, the Healthcare Whisperer. Hari is a healthcare advocate and a family nurse practitioner and has direct experience in navigating the healthcare system, and she can help you to find the best possible healthcare. So Hari, I've read that there is a new study that shows that 1 in 20 diagnoses is wrong, and this makes a strong case for getting a second opinion. Can you help us with that?
Oh, yes, and I'm really glad you brought that up because the British Medical Journal just released this study. It's profound. 1 in 20 is a lot for someone to to get the wrong diagnosis, and it probably happens even more than that. What I like to tell people, and what I can really help people with, is get a second opinion. And now, with this study, it is so important to get a second opinion when you get a new diagnosis, especially if it's going to entail a lot of treatment. And you need to know your options. So what I like to tell people is, let's get a second opinion outside the group of doctors or the hospital that you go to. And the good news is that your insurance will pay for it. And then I can help you go through the options and figure them out. I can help you figure out the medical side. I can help you figure out whether this is going to work with your insurance, and I can help you figure out it's a good match with the doctor, because that's critical. Finding a doctor you feel that you can trust and that you can move forward with, and who will take good care of you.
Excellent. Well, Hari, thank you for sharing your wisdom again with us today.
It's always a pleasure.
And remember, folks, now you don't have to be alone during a healthcare crisis. Hari is available to you and is just one phone call away. So I encourage you to call her to discuss and solve your healthcare needs. And her phone number, again, is 1-866-980-HEAL. That's HEAL. 1-866-980-HEAL. After the show, be sure to visit the website, speakupandstayalive.com, for more life-saving information. Plus, that's where you can purchase the book, Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. Bring the book to the hospital with you. It's the best way to stand out, and in a positive way. And remember, we donate 2 handmade pillowcases to either a troop member in Afghanistan or to a local veterans shelter for every book sold, with your name on it as the donor. So for a mere $20, you benefit, and so does some well-deserving warrior. Give a meaningful and useful gift that really says, I care. Give the gift of healthcare safety. Purchase the book, the patient safety logs, and throw in some of those icebreaker cards. It's a one-size-fits-all present that everybody needs. You can order online at speakupandstayalive.com, or you can request by email at speakupandstayalive.com, or call me 440-725-5462. And now, back to the show. You are listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau, and our guest today is Pam Klopfer. She found me on the radio. As she shared her story, we became friends. She organized a presentation where I spoke to her friends and family about hospital hazards. And the more I learned of her story, the more I realized that I have to join her efforts to spare others from what she encountered. Now, if you play a brass instrument like a saxophone, trumpet, or tuba, or a wind instrument, you are at a higher risk for developing a lung condition called hypersensitivity pneumonitis. This hypersensitivity is actually caused by mold and bacteria that builds up inside wind instruments and is unknowingly inhaled when they're played. When the particles get trapped inside the airways, the lungs become inflamed and extremely sensitive. And if left untreated, it can develop into a more dangerous condition. So Pam has agreed to visit with us today to share her experience and her findings. So welcome to the show, Pam.
Oh, thank you, Pat, for having me on today.
I'm glad to have you here. Pam, your husband was a trombonist in a swing band and developed what's called trombone player's lung, yet it went undiagnosed. Would you mind sharing how you came to determine this diagnosis?
Yes. Throughout his hospitalization, the neurologist and that just could not figure out what was wrong with him. His paralyzation became more each day. Through all of this, he had paralyzation of the central nervous system. He did have pulmonary embolism, and that is one thing that occurs through having bacteria in the body from trombone player's lung. How I came about finding out more was watching the NBC News on March 21st of this year. And Dr. Stuart Levy from Tufts University was on about one individual who became very ill from trombone player's lung. The more he talked about it, I realized that possibly could have led into what happened to my husband. So I immediately got the trombone, the newer one I bought for him on our 38th wedding anniversary, and the older trombone that he played in his high school days. And was through Dr. Levy, he advised me to get with a lab that would swab the trombone and see if anything was with bacteria. So I did find a microbiologist, and she swabbed the trombones, and also we took through a water bath of the trombone slides. She had the cultures, and they grew. And she was just shocked that there was aspergillus, which is the main one that causes central nervous system paralyzation. And the fusarium is being found enormously in different porns, especially high school kids that are neglecting to clean their instrument, and professional musicians. So the more I went into this, the more I realized that I feel this was the beginning cause of my husband's medical condition.
And so the first signal that something was seriously wrong was when he became paralyzed?
His first thing was that he coughed a great deal and didn't realize that at that time that when he was playing the instrument, and he played in a dance band on the weekends, but if there wasn't, he also practiced once a week, but he had left the instrument in the trunk of the car all the time. And through many days of heat in the summer, I'm sure that caused a buildup. When you play a trombone, saliva goes through the slides down to the spit valve in the curve. That's why it's so important to clean the instrument each time you're playing it, not waiting months or years. You must take care of the instrument to have it clean. And always the mouthpiece is cleaned with alcohol, not with water, because you need to kill the bacteria in the mouthpiece that build up in there.
These kind of molds don't just occur with musical instruments. I found a huge list of situations, a huge list that could cause this hypersensitivity pneumonitis. And interestingly enough, Pam, trombone player's lung was not on the list. Here's a few. There was bird fancier's lung. The antigen is from bird and feather droppings. There was cheese washer's lung, from cheese casings, coffee worker's lung, from coffee bean dust, farmer's lung, from moldy hay, hot tub lung, from mist from hot tubs, Japanese summer house lung, from damp wood and mats. There was thatched roof disease, tobacco worker's lung, wine grower's lung, woodworker's lung. So anywhere there's a situation for mold and fungus to grow, this is a possibility. And I just found it astounding that there was no mention of musicians. In further research, they talk about that when large colonies of mold are present, it can cause brain damage for people that have been exposed for long periods of time. And it also very specifically said paralysis can occur, and left untreated, these molds can be deadly. So I just find it interesting that this is a known situation, yet I'm sure your husband told them when he went into the hospital that he was a musician, he played the trombone, and yet...
Yes, that is correct. I have it in the files that he, over 30 neurologists that consulted, I kept emphasizing too, he played a trombone in a dance band, but nobody picked up on it. I want to emphasize too that he had a lot of MRIs, but an MRI throughout my research will not detect a bacterial infection in the central nervous. It won't be picked up that way. The way that it has to be done is through a special blood culture so that they can determine that if the bacteria will grow in a lab, in a culture. And I think that was the one major problem, that it's always wanting to hurry up and get you out of the hospital, which I can agree on certain points, but at least to have had a culture done right away. But that wasn't done in his case. But here's some tips that I feel would help anyone, and especially all you high school kids, too, to keep in mind, and the parents to advise helping their child to take care of the instrument. First off, do not leave the instrument in the case all the time. Open the case and let light in. Mold breeds in the dark. Examine the instrument with a small flashlight to detect any mold inside and out. Keep chewing gum out of the case. Gum mixed with saliva can enter the mouthpiece and cause rapid growth of bacteria inside the horn. Keep up on all your dental care. Fillings that are missing can cause bacteria to rapidly to get through into your gum and central nervous system. Throw away rags that are being kept in your case. Repeated use of the same rag collects fungus and bacteria over time. Throw away all papers in the case or keep all your other items in a separate carry-all. Use disposable wipes to clean the outside of the instrument. Vacuum the inside of the case frequently. If you notice any trace of mold, dispose of the case and buy a new one. The main thing is to place the brass instrument in a tub of warm water and leave for approximately 20 to 30 minutes. Shake before emptying and check for anything other than clear water. If you detect something, it is best to have the horn and water with the particles analyzed by a lab. And you can use a musical instrument brush to clean the inside of the horn and slides. Do not ever just use water to clean your mouthpiece. Use only alcohol with a disposable wipe. Never let anybody play your instrument. Germs are transferable. The main thing is, too, if you don't feel you want to clean the instrument yourself, locate a musical instrument store in your area, and they will inspect your horn and clean it for you. So I hope that this will help. And I'm so thankful, Pat, that you're helping me to spread the word on what can happen. This is a serious medical condition.
It really is a serious situation that I was not aware of. And, so many children participate in their school's band ensembles, and I'm sure that many of those instruments are on loan. And so I'm with you. I think we need to reach out to the community, to schools, to children starting at a young age, because, if they're going to be a musician for the rest of their life, they need to know about this early on. So I thank you for sharing your story as a way to help others avoid what you've experienced. And it's been my pleasure getting to know you, and I want you to feel free to use this radio show as a vehicle to help spread the word about trombone player's lung, and you are welcome anytime.
Well, thank you, Pat. I appreciate that very much, and I plan to be an advocate to spread the word in behalf of my husband. So thanks again. I appreciate it.
Oh, you're a sweetheart. We thank you. And Pam, since you're here today, would you mind indulging us and playing our shocking news from around the world?
Okay, sounds like a good idea. Thank you.
All right. What happens if you become unable to speak for yourself and are in the middle of a healthcare crisis? Wouldn't it be comforting to know that someone you know and trust, a family member or trusted friend that you named, is on your side with complete instructions that mirror what you want to have happen to you? If you do not have a properly drafted living will or healthcare power of attorney, you are living dangerously. And if you do have these documents, when was the last time you reviewed them with someone? Well, my friends Pat Schraff and David King at Schraff & King are the ones to help you. Call them right after the show at 440-585-1600, 440-585-1600, or visit them online at schraffking.com. Now to the health side of life, when you need to de-stress and pamper yourself a bit, or if you have any skin issues, eczema, psoriasis, acne, rosacea, you must visit my friend Lisa Stewart at Celia Spa in Brecksville. She has state-of-the-art equipment not found in other local spas and is trained to relieve your aches and pains through massage, facials, and high-quality and effective skincare products. Call Celia Spa at 440-526-0522. That's 440-526-0522, or visit Solia Spa, SOLIA spa.com. Do you or someone you know work in the healthcare field Ask them if they know that bacteria can live on fabric for weeks and even months. Think of the cross-contamination opportunities. Think of scrubs. How are they washed? With bleach? Oh no, that would ruin the pretty colorful designs. Most scrubs are made from poor quality broadcloth and are not bleachable. BrendaJune.com scrubs, their fabrics drape beautifully, they breathe, and they move with you as you go about your busy day. Pants, skirts, tops, their fabrics are durable and bleachable. If you wear scrubs, you owe it to yourself and your patients to wear scrubs responsibly. Visit BrendaJune.com for high-quality, American-made, bleachable scrubs. That's BrendaJune.com. Take control of your protection today. Visit BrendaJune.com or call 1-855-668-7278. They make a great gift, too. That's BrendaJune.com. You are listening to Speak Up and Stay Alive, Patient Safety Radio. Now you can join us every Saturday morning in Cleveland, Ohio, or listen to us live online from anywhere in the world at the station's websites. I am your hostess, Pat Rouleau, so happy to spend this hour with you to help you survive any healthcare or hospital encounter. And remember, if you like what you hear on this radio show, I speak live and in person too. In fact, we're even better in person. Our presentations are fast-paced, interactive, and chock full of immediately usable patient safety tips and tools. I can guarantee that your crowd will love it. No one's thrown food at us yet, have they, Bob?
You got it.
All right. So email or call us about speaking to your business, your club, church, or hospital. I speak both to the patient perspective or the provider. Email us at speakupandstayalive.com or call me directly at 440-725-5462. You and your audience will be glad that you did.
Shocking news from around the world.
Well, today, the boys decided to play one of our newest games, Shocking News from Around the World, and our guest, Pam, she kindly agreed to stay and play the game with us. Thanks for indulging us, Pam.
Oh, thank you. Okay.
All right.
I'm ready.
Goody. Our games are always a fun and fast way to share serious information. So here's how it goes. I will read a recent bit of shocking news, and you will use your keen sense of reasoning to determine if the statement is right, and that would be a shock, or is it wrong, and that would be a crock. So, is the statement a shock?
Wow.
Or is it a crock?
Oh. Oh.
Silly.
Okay.
All right, here we go. The Speak Up and Stay Alive shocking news number 1. Surgeons allegedly left 16 medical items in a body of a German cancer patient. Is that a shock or is it a crock?
Who wants to go
I
first?
say that certainly is a shock.
I think that's true. Okay.
I think so.
What do you think?
It could happen. We're finding out all the time what's left in somebody with surgery.
We are. What do you think, Joe?
I think it's a shock, but I don't think it was a German. I think it was a Frenchman.
Why?
Oh.
Oh, you don't want to go there.
Oh, my
What do you think,
gosh.
Bobby?
Well, personally, I know it's a shock because I heard it on the news, so I'm going to say that is definitely a shock.
You guys are right. It is a shock. Very
Okay.
good. It's true. A hospital in Germany is being sued for medical malpractice after surgeons allegedly left more than a dozen medical odds and ends inside a cancer patient's body during a 2009 operation. The man had undergone a routine surgery for prostate cancer. The operation was believed to have gone well and was told that he had at least another 6 years to live. However, post-surgery, the man discovered that his wounds had healed badly, and according to his family, the pain was so intense that he often could not sit. So when the surgeons operated on him again, they were stunned to find 16 pieces of medical equipment in his body, including a needle, a 6-inch roll of bandage, 6-inch long compress, several swabs, and a fragment of a surgical mask. And it took them 2 operations to remove it all. But here's the kicker. This is what I don't believe. This hospital claims that the instruments may have found their way into his body after the operation.
Oh, come on. Well, that is a shock, too.
That's a shock also, Pam.
That is a
Right.
shock. You know, we've been talking about disclosure, apology, and resolution these last few weeks. Can you imagine not just denying that that was an error, but then suggesting that these 16 items somehow mysteriously found their way into his body after the operation?
I don't think so.
I don't think so either. No.
I don't think the guy was eating needles, do you?
No.
All right. Here's the Speak Up and Stay Alive shocking news number 2. Hold your hand flat and look closely at the length of your fingers in relation to each other. Is your index finger shorter than your ring finger? They're saying that this is a test for osteoarthritis. Is that a shock or is that a crock?
Personally, I believe that's a crock.
That's a crock, but there is, I've heard once, I don't know if it's true about your heart condition, but I would say it's a crock.
Okay, what do you think, Joe?
I'm not sure which one's my index finger.
I'm pointing at you, Joe.
I'm just kidding.
I know you are.
Wait, so the index finger is shorter than the ring finger?
Yeah, if it's shorter than your ring finger, it's a good test for osteoarthritis.
Oh, well, I'm screwed.
Answer the question. Is it a shock or is it a crock?
It's a crock.
No, it isn't right.
No?
It's a shock.
Wow.
It's true. It's true.
It's true?
Here's what it is. A recent study at the University of Nottingham in England found specifically if a woman's index finger is shorter than a ring finger, she's more than twice as likely to develop osteoarthritis of the knee or hip. So,
oh dear, I got mine is shorter than my ring finger.
Well, don't panic. Just be on the alert for signs of osteoarthritis, such as pain in your knee, hip, or
Mine's
shoulder.
shorter too, Pam.
Well, we don't know what it means for guys. Well, anyway, according to the article, women, don't worry. Just be on the lookout. Here's the advice for the guys. If you notice your girlfriend or your wife checking out her ring finger, distract her by buying her a drink. I don't know.
Okay, I will research.
All right, let's research that.
Okay.
All right, you guys, the Speak Up and Stay Alive shocking news number 3. Scorpion venom could help treat brain cancer. Is that a shock or is it a crock? What do you guys think?
I think it's a shock.
Joe thinks it's a shock. What about you, Pam?
I think it's a shock.
Okay.
You know, I'm going to say shock.
All right. It is a shock. It's true.
Okay.
Wow.
Yes.
Well, we made it, guys.
You guys did it. It's called the Death Stalker scorpion. It's a specific scorpion. There's a peptide called chlorotoxin. It has been shown to be a potential for treating human brain tumors. And there's also been some evidence to show that other components in that venom may aid in the regulation of insulin and therefore could help with diabetes.
Oh, that's great.
But it's not the scorpion found in Arizona. It's an Israeli scorpion.
Well, maybe we need to go to Israel and find one.
Yes, you'll have to find one. Well,
I don't want to be looking for one. How's that? I want to be bit by a scorpion. All right, guys, the Speak Up and Stay Alive shocking news number 4. Eating a fatty meal before surgery boosts your chances of a fast recovery. Is that a shock or is it a crock?
it's a crock.
It's a crock. You're not supposed to eat it all, from what I understood.
What do you think, Bobby?
That's right.
I don't know because I hadn't had surgery one time and I didn't eat then, so I wouldn't know. I'm going to say crock.
Yes, you guys are right. You're good. It is a crock. Although,
You're not supposed to eat a fatty meal that much of any time. So,
absolutely. So,
That's the reason we eat
Okay.
fish, isn't it?
well,
that's right. That was fish that we had, which was delicious. So
it was delicious.
you have to come back and have it again.
We will. Anyway,
Oh.
researchers suggest that a low-fat diet in humans before surgery may decrease the incidence and severity of complications that are brought on by inflammation. The trauma of surgery impacts the chemical balance of fat tissue. And in a study of mice, that when the mice consumed a typical Western diet of high-fat diet showed an exaggerated imbalance response. So I may be restricting food intake to a lower fat diet just prior to days of surgery actually might help reduce complications.
I would
That
think that
sounds
would be
logical.
the best thing to do.
That sounds logical.
Yeah.
Mm-hmm.
Okay.
It does.
No more fried dill pickles. All right, the Speak Up and Stay Alive shocking news number 5. Sphenopalatine ganglion neuralgia
Okay, you're making it up right now.
happens when you eat ice cream or gulp something ice cold too quickly. Is that a shock or is it a crock?
Oh,
You have to say that again.
Yes, let's go over that again.
Okay.
What condition?
It's called sphenopalatine ganglion neuralgia. Happens when you eat ice cream or gulp something ice cold too quickly.
Is that brain freeze? Is that what you're trying to say?
Yeah,
Bob,
it's a shock.
Well,
It's
I'm
a
just going
shock.
to take a guess and say a shock.
it is a
That's a
shock. And yes, Bob, you're
Okay.
right. It's better
Wow.
known as brain freeze.
How you like that one?
Bob, you're good.
Well, guess what, everyone? I made homemade peach ice cream and homemade pistachio ice cream today. So I will be very careful when I'm eating that I don't have that happen.
Well,
So,
you know what? If you made that homemade ice
small
cream, Pat's getting ready to make a homemade peach pie, so we could put them together, Pam.
Ooh, that sounds great.
Oh my gosh, you guys. All right. Well, when you eat your ice cream, just don't gulp it. Actually, brain freeze is really a type of a headache that comes on fast, and it's resolved as well. And I want to explain to you how it happens so you guys don't do it. When you slurp a really cold drink or eat ice cream too fast, you're rapidly changing the temperature in the back of your throat, and that's where the internal carotid artery, which feeds your brain, your eye, your forehead, and your nose, it meets the cerebral artery, which is where the brain tissue starts. And I guess the brain doesn't like for things to change, so it freezes to prevent you from doing that. So what do you think the cure would be?
Let it melt.
The cure?
Yeah.
Yes, I would say, and don't do it again. Just use regular tap water, not cold.
Exactly. Stop drinking it that fast. Actually, they say you could jam your tongue up to the back of your throat so that you could warm it up, or drink something warm to normalize the temperature.
Well, I guess also when you're out working in the heat, mowing or working, don't come in and try to get a glass of ice water. That's the worst thing you can do. You just want to use it regular tap temperature.
That's true. They say the ice water actually isn't really good for you. All right. So now you know what sphenopalatine ganglion neuralgia is. Let's not call it brain freeze anymore, guys. Let's get
brain
serious.
freeze. I have that most of the time. But I didn't know the condition. Now I'll know.
Now
okay.
you know.
All right.
Oh, you guys are crazy. And here's our final Speak Up and Stay Alive shocking news. Emails, phone calls, and comments, as well as other random research, suggests that you may get better service from your hospital providers when they see a copy of the book Speak Up and Stay Alive on your hospital tray table. Is that a shock, or is it a crock?
That's a shock.
That's definitely
and I
a
think
shock.
That's the best idea to ever have.
What do you think, Joe?
Well, I'm just going to say it's a shock, even though you
Joe
guys are
didn't
looking
take-
at me to say it's a crock so you can make fun of me.
Joe, you didn't take your book to the
Oh, you
hospital last time, did you?
No, but I made sure that they all wash their hands.
That's good.
Good.
If you'd taken the book, you'd got a little bit better results.
That's right. Because so many people have told me this, Joe. In fact, I have a copy of an email right here in front of me. And it says, Pat, I bought your book at our company's presentation. The next day I had emergency gallbladder surgery. I grabbed your book thinking I would have a chance to read it. I laid it on my tray table, and I tell you, everyone who came in asked about it. I think it definitely set me apart from the rest of the patients on the floor. I received the best service ever. They even washed their hands. And that's not the only time I've heard a comment of that type. So, folks, for $20, you can get better service, more hand washing, and your providers will know that you are an informed and empowered patient without saying a word. So let me ask you guys, if someone said prior to your hospital stay, for $20, you will have a safer experience, would you trade a 20 for a better outcome?
Definitely.
Oh, yeah.
Definitely.
Absolutely. Wow. Oh, that was a late wow, huh? Well, thank you guys. I'm glad that you all stuck around to play everyone's favorite game.
Shocking news from around the world.
Thank you, Pam, for playing the game with us today. We appreciate having you here.
Okay, thank you. Can I come up now and have peach pie?
Come on, Pam.
As long as you bring your ice cream.
Okay. We'll have
You got
to do that
two and a half hour drive, Pam. Come on.
Oh, I'll make it. Won't take long.
All right.
Okay.
Thanks, Pam.
Thank you again, too.
All right. Well, that was fun and enlightening. And don't go anywhere. There's so much more you can learn about healthcare and hospital safety on America's favorite and perhaps only patient safety radio show, Speak Up and Stay Alive Radio. Are you living with or know someone who has Alzheimer's or dementia? It's a fact. Providing support for a loved one with Alzheimer's or dementia can be very challenging. At Senior Helpers, their professional, trained caregivers take a positive approach to Alzheimer's and dementia care with their unique Senior Gems program. Just like a valuable diamond, ruby, or emerald, the Senior Gems focuses on what is precious and unique about your loved one, with an emphasis on what your loved one is still able to do. Their caregivers use techniques designed to foster supportive communication, promote a positive environment, and provide meaningful activities. They also work closely with a dementia expert and registered occupational therapist that allows them to understand which stage of dementia the person is experiencing in order to put together the best plan and select the best caregiver for that individual. Senior Helpers has created an informative DVD that can assist you right now in your efforts to help your family member with this disease. To receive your complimentary DVD, your guide to supporting family members with dementia, please call Senior Helpers at 1-877-922-STAY, S-T-A-Y, 1-877-922-STAY. Yes, you heard me correctly. This is a free DVD and is just one phone call away. 1-877-922-STAY. So if you would like to know more about the Senior Gems approach, or to speak with a Senior Helpers elder care expert about creating a customized Alzheimer or dementia care plan for your loved one, please call 1-877-922-STAY. Senior Helpers, care and comfort at a moment's notice.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare safety snippet just for you. Sponsored by the Junction Auto family. People you can trust for your next Buick, Chrysler, Dodge, GMC, or Jeep. US 322 and Ohio 44 since 1931. Or visit junctionautofamily.com. If you want to pay more, that's your business. If you want to pay less, that's Junction's business. Here's our expert, Pat Rulo.
Hey, Jerry. Smart hospital patients know that you and your buddies hang out all over the place. We know your hiding places. Doctors' lab coats, privacy curtains, the TV remote, and even hospital pillows. My friends know not to bring their favorite pillow with them to the hospital and then bring it back home. You'd just love to hitch a ride and get out of the hospital, wouldn't you? If we must bring a pillow, we bring a cheap one and leave it at the hospital as a parting gift. No cross-contamination here. For more hospital safety tips, visit speakupandstayalive.com.
Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayalive.com.
Is your home stressing you out? Are your appliances and gadgets damaging your health? Are you concerned that modern technology could be ruining your and your family's health? Scientific evidence suggests that everyday chronic low-intensity magnetic field exposure poses a possible health risk. Therefore, the conclusion is that magnetic fields remain classified as possibly carcinogenic, meaning they can cause cancer. And what about the radiation levels from wireless computers, routers, cordless phones, baby monitors? I know I've experienced disrupted sleep, grinding teeth, headaches, and waking up tired and didn't know why. Others I know experience hyperactivity, concentration and memory problems, muscle and joint pains, cardiac palpitations, fatigue, irritability, and erratic high blood pressure. And after multiple visits to doctors, still could not get an accurate diagnosis. Finally, I asked myself, could all of these symptoms be caused by invisible hazards? There is a growing body of research that shows that today's ubiquitous technology can be damaging to our health. So I had someone come to my home with highly sensitive measuring devices to measure the levels of electric frequencies, magnetic frequencies, radiation frequencies, and dirty electricity within my home. Oh my, was I ever shocked! Things like cell phones, routers, chargers, power strips, smart meters, dimmer switches, and on filled my supposed sanctuary with invisible yet damaging health hazards. Once I removed these hazards from my home, I slowly began to feel better. So I'm suggesting that you too have a healthy home consultation to identify problem areas in your home. The folks at Healthy Home will test the EMF levels in your home using small, specialized equipment, focusing particularly on areas of the home where you spend most time. And then we'll make recommendations about how you can reduce your exposure and minimize the effects on your health. The home consultation includes full measurements of electromagnetic fields within every room in your home. It takes about an hour, and you will be given a comprehensive report that includes full recommendations on how to reduce the negative impacts of EMFs and turn your home into a healthy, healing, and safe environment. And for a limited time, I'll even come out with them to meet you and help explain the findings. Call me and I'll pass on the information. 440-725-5462. Don't feel like this. When you can feel like this. Schedule a Healthy Home consultation today, and I'll come too to meet you and share what I know about healthy homes. Call 440-725-5462. That's 440-725-5462. And remember, a healthy home is a happy home. You are listening to Speak Up and Stay Alive, Patient Safety Radio, every Saturday morning in Cleveland, Ohio. I am Pat Rulo, your hostess and author of the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, available at all of our live speaking events or at our website, speakupandstayalive.com.
Tired of the same old presentations?
Can you forward to slide 38, please?
Are you looking for a new, out-of-the-box topic for your next event? Want your group to leave inspired, informed, and satisfied? No PowerPoint presentations and dim lights here. No snoring or snoozing goes on during Pat's presentations. To help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite Pat to speak. Her presentation formats vary from 15-minute small talks to 30-minute lunch and learns, to 1-hour events called The Scoop, to full days. Pick a topic from her website or request your own. Visit her website, speakupandstayalive.com, or call Pat to discuss how she can make your next event fun, enlightening, and life-saving. Want testimonials? Go to the bulletin board link at the website for color pictures and comments from real people. Again, it's speakupandstayalive.com or call 440-725-5462. That's 440-725-5462.
Let me ask you a question. After today's presentation, what do you know now that you did not know an hour ago that might keep you safe if you are in the hospital?
Make sure the people attending me wash their hands. That's so important.
That's very important. And will you feel able to ask, would you please wash your hands?
I think now I will. I've learned many things from your presentation.
And your name?
Bernadette. Question everything.
Good work. And your name?
My name is Gladys. Yeah, I'm so glad I came.
I'm glad to have you here as well.
My name is Elaine, and today what I got was that I've been supported, these things that I've been saying for years, now I have an advocate to support me in saying it.
And you are a nurse, is that correct?
Yes, that's correct. People need to hear this so that they can save their lives.
We've got another lovely lady who has to speak.
My name is Denise. I'm the activities director. I just thought it was really interesting on the cross-contamination, the lab codes, just how many germs are on the lab codes, how doctors may not wash them, their neckties, just your clothing, how that can all carry germs, just things I never thought of that I was made aware today.
And I appreciate being here and making you aware of that. Thank you.
We're very happy you came. We're very happy you came.
Anybody else that would like to speak with us? Anybody else? One of you guys.
Oh, I'll talk.
Yes, of course she'll talk. And what is your name?
My name's Kelly.
And you work here?
I do. I work in the activities department.
And you guys do a great job.
Thank you. Thank you. I just learned the importance of really being an advocate for your loved ones and also for yourself and just not being afraid. A lot of times we're so intimidated by the people that are taking care of us that we're afraid to question them, feeling that it might offend them. But really, I'm sure they want to make sure that they're doing the best job too. And sometimes, like you had said, it's just because maybe they're overworked or busy. And so I'm sure they appreciate the fact that we're just trying to keep ourselves safe, which would keep them safe in turn. So just really about being able to, like your presentation, the title, Speak Up and Stay Alive. It's the perfect title for your presentation. It's really good.
Always a fun way to share important healthcare and hospital safety tips and tools with you. Well, today we talked about misdiagnosis. It is common, and there are some things we can do to avoid it. Awareness, as usual, is the key. Bring someone with you to all doctor visits. Keep track of your test results, and if something just doesn't seem right, then it probably isn't. There's a lot more about this in my book, so I do hope you have a copy of that. And our guest shared her story about trombone player's lung and how uncleaned musical instruments, brass and winds, can harbor life-threatening molds and fungus. If you or someone you know plays an instrument of this type, please do them a giant favor and tell them about this. Have them listen to today's show, which you will find posted on our website, speakupandstayalive.com. Just go to the radio link and you can review what you've heard today. After the show's air, we post a link on the website, so if you want to hear it again, or if you're lonely, bored, or otherwise unoccupied, now you can join us again and again. I think it's safe to say that when you join us each week, you may be adding years to your life or to the life of someone you know and love. And tell your friends, patient safety should not be a secret. Start your week with an O. Speak Up and Stay Alive, RadiOh. And be sure to listen next week as we continue to inform and entertain, all the while keeping you safe during every healthcare and hospital encounter. In the meantime, I hope you have a healthy and a happy week. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem and should not be considered as medical advice. If you've missed part of today's show or just want to share the information with friends, you can listen to all of Pat's previous shows at speakupandstayalive.com. Want even more information? Purchase a copy of Pat's book at speakupandstayalive.com. Have questions or comments? Become a friend on Facebook. We're called Speak Up and Stay Alive. Or you can call Pat at 440-725-5462. Until next week, remember, you have to speak up and stay alive.